Guthrie, America. We are here today at Mercy Clinic Academy. And ladies, you wish you were me today. I'm in the room with two, count them, two, Dr. McDreamies. I'm here today with Casey Cochran and Arvin Porticon. Welcome to Guthrie.
Thank you for having us.
Thank you very much.
Yeah, we're excited to hear more about you guys today.
Excellent.
That's awesome. So we have a couple questions for you. Tell me, Dr. Porticon, where did you go to school?
I grew up in Edmond, Oklahoma, and my family's still there. Brothers and nephews are all there. And I went to Edmond Santa Fe High School, where I graduated. Went to UCO for my pre-med, played varsity tennis there while doing my pre-med studies, and then traveled up to Tulsa the last 7 years for medical school at OSU, and as well as family medicine residency.
Okay, that's great. So you haven't traveled too far?
Haven't traveled too far, but I was definitely ready to come back home to Edmond and be around family and friends.
That's
so,
great.
Yeah.
That's great. How about you, Dr. Cochran?
So I grew up in the Panhandle of Oklahoma, a little town called Boy City, very into the Panhandle. I went to undergrad in Weatherford, Oklahoma at Southwestern Oklahoma State, and then I went to medical school in Knoxville, Tennessee.
Oh, wow. Okay.
Then I came back out here to Oklahoma City for residency, and then just finished that in July, and now I'm up here.
Okay,
So,
that's
yeah.
great.
Yeah.
So now both y'all haven't been practicing very long then?
Residency is when you start as a physician. We've both been practicing about 3 years in residency. Finally, completely out on our own, getting to take care of patients and try and make everybody healthier in the community.
That's great.
And knowledge-wise, I've been practicing a lot longer than others.
Okay, yeah. You know a lot more.
No, I'm pretty sure I'm over there picking your brain all the time, so that's exactly.
We're here for each other, which is really great to have. Yeah.
I was going to say,
yeah.
It seems like you guys are a great team.
Yeah.
That's fun.
Yeah.
And do you all have a specific specialty? Do you only see certain type of clients? Are you open for everyone?
Definitely. I feel like open for everything and anything. I know we both have different interests. I love cardiac stuff. I love dealing with diabetes. Anything and everything. I love seeing children. I like everything from newborns to 90s, 100 years old.
Okay.
Everything and anything.
We're both osteopathic physicians, so we both do some alternative medicine if there's people having chronic pain, back pain, knee pain, anything like that, neck pain, that we can do some other techniques and treatments if they don't want to jump right into medicine. We also do joint injections and manage arthritic patients and try our best to take care and alleviate pain that way.
That's great.
That kind of brings up an extra point that I think we've been trying to spread through word of mouth since we've come to the community, but I think this might be a good avenue also. Is the whole nation is battling a huge war right now on prescription drug abuse.
Absolutely.
A huge war. And we came into this clinic and we understand pain.
Yeah.
We know people have pain and people have reasons for pain. Our goal is to really manage it appropriately, get people help that's going to help them,
Yeah.
and not just cause more problems
Yeah.
and cause more problems to the community. Him and I have talked about it a lot since we've been here, and that's kind of the nice thing, being on the same page, is that we feel like the battle on this huge front has to start with us. We as physicians have started this problem by handing out medications just here and there.
Yeah.
And so we try other things for people that are hurting. We don't want to jump to something that's going to cause them more problems and more long-term issues. So.
And Oklahoma's been this last year #1 for narcotic prescriptions, and so we've really jumped on that when we came into this clinic, and we've already noticed that we've kind of helped the community a little bit of Guthrie understand better how to manage pain appropriately, to where we're not just putting a Band-Aid over it, that we're actually treating the problem. And what I like to tell my patients is pain's not necessarily a bad thing. Pain sometimes is a good thing. It reminds you that your nerves are working and you're feeling it and you got the sensation. That's good. Your body's responding to it. And so we don't want people to live in pain chronically, which cause other problems, but we definitely want to manage it appropriately, and I think we're the ones who can do that. So.
Okay, that's great. I think that's an awesome thing to bring to the community. Definitely something different. So what brought you all to Guthrie?
A bunch of my friends that grew up in Edmond, I told them, I'm looking at Guthrie, and they said, oh, you're going to love Guthrie. Guthrie's a neat town. Loved it here, loved the hospital, loved the people that worked here. rotated here before I graduated residency and just felt like a good fit. Give me both sides. I felt like I still see the farmers and that rural community that I would see out there, but also I have a mix that I'm more used to that like I saw in residency as well. And so it's a good mix of different people in society, and so that's kind of what brought me here.
Great. Dr. Parkon?
I got into medicine to help serve the underserved. And, you know, I grew up in a family with no health insurance, and having to try and keep ourselves healthy to not have to go to the doctor. Not necessarily that we didn't want to go, just couldn't go, couldn't afford it. It was close enough I could be home and around family.
The mission that Mercy presents is something that you can get behind. Just like Arvin talked about, serving the underserved and helping the people that from backgrounds that we both similarly came from. And Mercy really tries to help in those situations. And they're helping Oklahoma. I mean, we're seeing a lot of small hospitals that are going out of business, and these people wouldn't have care if people weren't coming in and trying to help things float. And so I really liked the plans that Mercy had for the future, and so that's what kind of drew me toward working with them.
So with the Mercy Charity Program, it sounds like that helps people who don't have health insurance, who need medical care, that they can come out and apply to see if they can receive those services?
Absolutely, they can come apply, and if they meet the requirements, income level and other requirements on the application, then they could possibly qualify for the Mercy Charity and be able to get health care and not have to worry about that.
That's fantastic. I didn't know about that. What interests you? What do you do when you're not here? I know you're here a lot, but when you're not here, what do you get to do, or what do you like to do?
I love to just be outside, be outdoors. That's my main thing. I grew up in a family of farmers and ranchers, and I live a life now that I'm indoors constantly. And so anytime I can get outside, I think that's my main thing. So I just have to learn from him to be a little bit more active and exercise in my outdoor time.
So you're the outdoor active person?
He used to be. He played baseball in college, and he's active. So we just got to get him to reconnect with his active lifestyle.
Okay.
Yeah.
Dr. Parkon, what are your hobbies?
I run every day. Every morning before I come to clinic, I run at least 4 miles. I've been a runner since middle school. I mean, I've been running, play tennis, like to be outdoors as well. Started using the Guthrie YMCA, going on my lunch break over there, and seeing some of my patients in there. And so if you're out there, thanks for doing what I've asked.
So do you do like marathons?
I've done the Oklahoma City Marathon. I've done the Cowtown Marathon down in Fort Worth, but I've not done the one up in Tulsa yet. There is 66, maybe one day. But
okay.
I'm not ready for it right now.
Not ready for that. That's okay.
Next month.
You have time.
Yeah.
You have time.
Yeah.
What was the last thing that made you smile?
Probably this interview.
Yeah.
We're interested.
That's a tough one. I feel like I'm smiling all the time. And so
I can see that.
I don't know, I could give you a cheesy answer that goes to
Sure.
medicine.
Let's give a cheesy one.
You can give us multiple and we'll
honestly, him and I have a lot of fun here. We
Yeah.
always, this is a job that you see some sad stuff. You see some hard things to handle. You see patients that need help that don't want help. You see, things that, so to have somebody here in an environment that you can joke around, that you can keep things light, and just come in here and shut the door and talk about things, But we do. We have fun here. We like to laugh, and we like to laugh with our patients.
I think some people forget that sometimes, but I think we would both agree that laughter is the best medicine and can change you. And so, absolutely.
We appreciate you guys. Thank you so much for taking the time to be with us on Chamber Chat today.
Thank
and
you.
if you're looking for a new physician, they are out at Mercy at the Academy Clinic from 7 in the morning until 5 in the evenings, Monday through Friday.
We're here till 5?
Wait, what?
Nobody told me that. And how we always close Chamber Chat is we like to say community
Wins.